When you hear the word chiropractor, do you think of lying on a table getting your back cracked? You're right, but they offer so much more than that. So our insider explains what.
A chiropractor is a primary care limited physician who specializes in the diagnosis and treatment of neuromusculoskeletal conditions and the effect of these conditions on the overall health of the body. And so the cracking sound that you mentioned, while you can hear the alignment of the joint being realigned, and that's the modality that we're best known for, chiropractors are also trained in identifying not just the physical stress, but also the nutritional stress and the emotional stress that makes people unwell.
So basically an overall component of health.
Yes.
Amazing. So how did you get into this field?
So I'm a third-generation physician. My grandfather was an internist, and my father is still a practicing gastroenterologist outside of Washington, D.C., where I used to be from.
Okay.
And when I was in my first career path, which was in corporate America, what I was taken by is that people were unwell and they weren't having a good quality of life. So when I went to look back to getting into healthcare, I decided that I wanted to operate at a physician level, which is diagnosis and treatment, but I wanted to be able to help people without drugs and surgery.
So then what isn't considered chiropractic care?
So anyone who's not a licensed chiropractic physician, so chiropractic care is, what's not chiropractic care is anything that is provided by anyone other than a chiropractor. So anything that is self-cracking sounds or anything done by a massage therapist. Yes, which is perfectly safe.
Okay.
That is not chiropractic care, because chiropractors, again, focus on the diagnosis and the removal of something called the subluxation. And these are fixations in the spine that also interfere with healthy balance of the nervous system.
Okay, and just a reminder, if you have a question for the doctor, please call in using the toll-free number this hour, 855-796-4475. We're here to help you and answer all your questions. So the term chiropractic breaks down hands-on therapy, correct? So what can you tell us about then chiropractic care and its meaning, its history, and how it's evolved to what it is today?
That's right. So chiropractic does mean by hand, and while manual hands-on therapy and spinal manipulation has been around for thousands of years, over 100 years ago, a man named D.D. Palmer discovered the art, science, and philosophy, the system that we follow today, that is chiropractic. And so we operate at a physician level to diagnose and manage these conditions.
Amazing. So are they covered by health insurance or included sort of in a medicine treatment?
Yes, so all health insurance covers chiropractic care. It's in VA hospitals, it's covered by Medicare and Medicaid, but of course you want to double check with your insurance to find out if you qualify.
You also mentioned something before. You said that you're a chiropractor at the physician level. So is there a difference as to chiropractors that are not?
No, so all chiropractors have to sit for a national board exam. We're governed by the NBCE, and then we also apply for separate state licensing. But there are lots of healthcare practitioners who are not designated as a physician legally when they're seeing patients.
So what type of education does that entail?
That's another great question. So it's about 4,500 hours of classroom, lecture hours, clinical lab experience, as well as an internship, which rivals the intensity and thoroughness training of a medical doctor or an osteopath. However, when it comes to the treatment portion of the show, we do not do drugs and surgery. We go to hands-on care and lifestyle factors.
Okay, and then you follow the same regulations and ethics as MDs and DOs, correct?
Absolutely.
Okay, I can't wait to get more into this. Okay, so now that we talked about a little bit about the training, what goes on, it's 4,500 of extensive training. So at what point, what are people seeing chiropractors for? And when do they come see a chiropractor?
I would say that the most common reason that people come to see a chiropractor is pain, the thing that we're best known for, again, the spinal manipulation. People come to us for anything from low back pain to neck pain and headaches. And I would say that we not only excel in these areas, but they're extremely safe. And the Consumer Reports shows that for all physicians and healthcare practitioners that see people for these conditions, that chiropractors rank #1 with satisfaction.
Can I ask you, what then is the difference between a chiropractor, let's say, and an orthopedic?
So a medical doctor, orthopedic, can diagnose and treat with drugs and surgery. So for example, you come in with low back pain.
Okay.
And it's not a fracture, tumor, infection, cancer, any of these red flag items that do need to be managed by a medical doctor.
Absolutely.
And the treatment options that they have in their office are either pain medication, an injection, or a surgical procedure. And so I would say that's probably the biggest difference, is how we decide to treat patients in the end.
And there are a lot of benefits to seeing a chiropractor, and let's look at these to get a sense of the range of patients that you treat. So first off, back or neck pain, which is probably the most common, correct?
Yes.
Okay. And if you can talk to us about the rest as well. These are patients that you see and you treat them for headaches, insomnia, you said as well?
Yeah, indigestion, any general injuries, heart problems, and you might be wondering why a chiropractor would see a patient for something that's not musculoskeletal. And so you'll see here on the spine that we have here, and some infographics we're going to look at later, is that when you see a chiropractor, it's not just about removing musculoskeletal pain, but we're talking about the intricate relationship with what the spine encases, which is the brain, the spinal cord, and all the nerves that communicate with the nervous system. So if you or someone you know has been to a chiropractor for something like heart issues, asthma, breathing problems, indigestion, infertility, in children, I see children with chronic earaches. We're talking about aligning the spine and removing communication interference and soothing the nervous system and the communication between the brain and the rest of the body.
That's absolutely incredible. So then a lot of these ailments are tied to a disalignment, would you say then?
So we call them misalignments.
Misalignments.
Right, because unless it's a life-threatening disease or a fracture or something that truly needs a medical intervention, we're talking about a loss of balance in a naturally balancing body. That's called homeostasis. And so a chiropractor looks for these imbalances in the spine and the nervous system and is able to quickly and safely correct them.
Dr. Doman's tips for finding a chiropractor is by word of mouth from family and friends. And to watch more of this interview, download our free Health Channel app. And remember, if you have a question, please reach out. We'd love to hear from you. Send us an email by visiting our website, allhealthtv.com, or give us a ring, 855-796-4475.